Hi, welcome to Medicine with Dr. Moran. Today's video is all about stress echoes. What is a stress echocardiogram?
Well, lots of my patients come to my laboratory for this. It's a special test. It evaluates blood flow to the heart and to check for blockages in the heart arteries. We call this coronary artery disease if you have a blockage. It can assess people's symptoms such as chest pain that might represent a blockage. It can also assess things like shortness of breath. It can help us with fainting spells, particularly if they occur with exertion. We often use these sorts of tests to evaluate for heart rhythm disorders, as well as people that just have known heart disease, and we want to see what happens when we exercise them and whether it's safe to do that. We often do this before heart rehabilitation programs. It gives us a lot of information about diagnosis, prognosis, and treatment effects. It gives ECG data as well as echo or ultrasound picture data. It has much better accuracy compared to a treadmill stress ECG test, which is only where somebody's going to exercise with the ECG on. We don't just get ECG tracings, we also get the pictures using ultrasound. Now, the accuracy of the test is approximately 85%. It's the same as if you have a cardiolite or MIBI or thallium type stress test, but at about a third of the cost and without radiation exposure. It provides a lot more information than the myocardial studies using thallium or MIBI because it tells us a lot about structure and function of the heart. It's also a much faster test. The test generally takes 45 to 50 minutes. The risks of the test are the same as any stress test. A heart attack or other serious life-threatening complication occurs in about 1 in 5,000 tests. We do have the necessary equipment and medication if there were to be a problem. Patients generally exercise for 6 to 10 minutes. The majority of my stress tests, I use the supine bike, as the vast majority of people prefer this form of exercise to regular treadmill exercise. Utilizing the bike allows us to image throughout exercise so we can see what the heart's doing while you're exercising at the beginning all the way through peak exercise. That way we can diagnose an abnormality when it first occurs, which makes the test a lot safer. There are times, at least 3 or 4 times a year, where I'll stop a test even though the patient has no symptoms and the ECG might be normal, but I do not like the abnormality that we're seeing on the screen as we're imaging. And so this is one of the reasons why it makes the test much safer. The other thing is the ability to image throughout exercise as well as immediately after improves picking up abnormalities as opposed to treadmill stress echo where we only get images immediately after exercise. I'm a registered sonographer. I have passed certification and recertification exams in echocardiography with the National Board of Echo, scoring in fact in the top 2% of examinees. Providing accurate comprehensive examinations are important to us. We use state-of-the-art 4D echo equipment with network 4D interpretation reporting software. The test is done with a technician who accompanies me, and this technician is a qualified sonographer, which is someone that's skilled in ultrasound.
How do you prepare for the test?
Well, firstly, the time that we give you, we've got it scheduled and reserved for you. If you can't attend for any reason, call my office and reschedule. It may be important for certain heart or blood pressure medications to be held before the test. Myself and my staff will instruct you in regards to this. Okay, we've recovered from that. That was Caffrey pulling down the camera. Now, it's important before the test that you don't consume any caffeine, which means coffee, tea, pop, or chocolate for 12 hours before a stress test. Do not eat or smoke for 2 hours before the test. Avoid any heavy physical activities the day of the test so that you can perform well. It's important to wear comfortable pants or shorts as well as shoes for the test. If there's any reason why you cannot exercise, please bring this to my attention or my staff's attention. It's also important, as you should do for every visit, is to bring in a list of your prescription medications. Men, if they're hairy, need to shave from the bottom of their chest, the bottom of the rib cage, all the way up to their shoulders so that the hair will not interfere with the ECG tracings. Do not apply lotions or baby oil to your chest for 24 hours before the test, or the electrodes won't stick and we will not get quality ECG tracings.
What is the actual echocardiogram stress test?
Well, the way this works is once you come to my office, the sonographer brings you into the stress room. We call it our stress lab, and they'll explain the test to you. The patient information sheet we have, you'll have an opportunity to read it beforehand, ask any questions, and you'll sign the sheet giving consent, which also means that you've read and understood the sheet and wish to proceed with the test. My sonographer will hook you up to the ECG and blood pressure cuff. Resting ultrasound or echo pictures will be taken with a transducer and gel between your ribs. On rare occasions, this might provoke a little discomfort if the rib spaces are small and tender. Generally, though, this is a painless test. While you're being scanned, do not talk, as this can worsen image quality. Now, after all of the images have been taken, I will be called into the room and we will start the exercise portion. When you start pedaling, the speed that you go is 60 revolutions per minute, which is 1 revolution per second. And generally, people exercise for 6 to 10 minutes. We will guide you to the speed. If for some reason we do a treadmill stress echocardiogram, then you'll go on the treadmill at obviously increasing speeds and increasing grades. The way we make the bicycle stress test harder is we put more tension on the bike. With the bike, you control the bike and the speed of the bike. With the treadmill obviously controls you, and that's one of the main reasons a lot of my patients, particularly elderly people, would rather ride the bike. And of course, if you're on the bike, our supine bike, you're actually lying on a table, and of course you can't fall off this bike. Whereas of course with the treadmill, people often have uncertainty and are sometimes concerned that they might fall. Now, during exercise, ultrasound images are taken. The bed may be tilted to improve image quality while you exercise. Sometimes after you finish exercising, we'll take your feet out of the pedals and we'll roll you on your left side if your images are significantly better, so that we get the best quality images immediately after exercise. I will ask if you got any symptoms during the test. And at the end of the test, I'll review the results with you personally. A report ultimately will be securely sent to your doctor or other health care provider. At the end of the test, I will review the images and I will review the results of the test with you. Once the data has been collected, I'll generate a report. This will be sent securely to your healthcare provider immediately after the test.
Thank you for watching this video about stress echocardiograms. If you liked it, please click like. If you'd like to see more videos like this, check out the channel and feel free to subscribe.
I'm Dr. Keith Moran. Remember, get healthy and stay healthy.